Hello there. Thank you for joining us today. This is Southern California's APWA COVID-19 series, Impacts to Public Agencies. I'm your host, Tran, and I have the privilege to be the chapter president for Southern California APWA. And in this episode, we'll be discussing and talking with LA Metro's Deputy Executive Director, Mr. Mark Linsenmayer. Before we begin, we'd like to kind of showcase what LA Metro is. And so to do that, we typically take a look at their website. So if you can see here on my screen, this is LA Metro's website, metro.net. And they basically take a lot of, I guess their boundaries are pretty much LA County and some parts of Orange County and things of that nature. So it's a very large agency. And that's why we're here today to talk about how is this public agency handling COVID-19 and what they're doing. So without further ado, I want to welcome Mr. Mark Linsenmayer to the program. So welcome, Mark. How are you doing?
Hi, Tran. Good. Thanks for having me on.
Absolutely. If you don't mind, I would love to go into the background and your background of what you do for Metro and really talk about what your agency is and just kind of the organization in general.
Sure, I'd be happy to. As you mentioned, I'm the Deputy Executive Officer for congestion reduction. So my primary oversight is the toll lanes in Los Angeles County, excuse me. So we oversee the operations of that and the planning and all of the environmental clearance and all of the funding for those programs, as well as the day-to-day operations. So we oversee that entire program. Metro, as the larger agency, as you mentioned, is responsible for bus, rail, transit throughout Los Angeles County. We do have service routes into Orange County, as you identified. We also do a lot of the micro transit, some of the scooters, the bike sharing programs, the paratransit, and other regional modalities for transit, including things like the car sharing programs and HOV lanes in the highways. So it's a sort of a soup to nuts transportation agency. We have just over 10,000 direct employees in Los Angeles County, and probably another couple thousand consultants and contractors that work for us on a daily basis.
Great. So it sounds like you guys really have quite a bit of employees, and that's why we're kind of talking today. A lot of different agencies are handling things differently, but at the same time, we're trying to, figure out how we can move forward and be the new normal for this whole COVID-19 pandemic. So as far as impacts, you do a lot of transit services. I'm sure those that are essential workers and those are going back into the workforce as things are getting lifted. How are you handling the transit services part, not only for the operator of the bus or the passengers? What are we doing, or what are you guys doing to help facilitate a clean environment as well as a safe environment for those that are going to utilize your services?
Yeah, so it's an interesting piece of it, right? Because as an agency overall, we're always, as transit employees and government employees, identified as emergency workers. So throughout the agency, even people like me in the planning and administrative functions have been identified as essential employees, so able to go back and forth into work. Our main headquarters building is our Gateway building, where a lot of our office personnel has remained open, although I think that building typically houses about 2,500 people, 2,200 people. We still, with all of our operating staff, our administrative staff, our security staff, we only see about 400 to 500 people in there daily. What we call sort of our frontline employees, like you identified, a lot of the transit drivers on the bus and rail side of it, and even the vehicles themselves. We're looking at as much thorough cleaning as we can possibly do on each of those throughout the day, nightly during shift change. We're asking all of our riders to wear masks. We're asking them to adhere to social distancing. We're making sure the boarding and alighting of those vehicles is done as safely as possible. We're obviously looking some of the fare box collection as to what we can do to do safer social distancing on that piece of it. So there's a lot of different aspects of it, but a lot of it is following the guidelines provided by the LA County Health Department in terms of sanitizing things, making sure that everybody's got the hand sanitizers, the face masks, and that we're providing whatever we can to clean those vehicles on a regular basis. I know we've done exploration on different things like UV lighting, which there's been some identification that that's a possible sort of antibacterial treatment that we could run every evening on our buses and trains. So there's a lot of different things that we're looking at, but right now we're trying to just do our best to address the typical social distancing, hand sanitizing, and the wearing of face masks as our primary, I think.
Oh, that's good. With that, obviously, not only do you guys do kind of the transit services, but you have ongoing projects in LA, in the county area and the greater areas beyond LA County. How's that going? I know we have a lot of private sector folks for APWA that are consultants that may or may not work with LA Metro, but they would be probably interested to know what the outlook is for projects for the future, current ones and planning, and what are you guys doing moving forward with those types of projects?
Yeah, so that's another topic of extreme interest at the agency, right? Because the agency itself is primarily funded through sales tax revenues. There's 4 different half-cent sales tax measures and propositions that we collect revenue from. So overall, it's about 2% of all sales tax in Los Angeles County goes to fund transportation through LA Metro. So when this all hit, a lot of our sales tax revenue really took a big plunge. So we've had forecasts of more than 50% decline in revenue. So our cash flow is really taken a big hit. We obviously are in line to receive CARES money from the federal government. For Los Angeles County, it's just over $1 billion. Much of that will go to LA Metro, but we also have other municipal providers and municipal DOTs that will be part of that, including MetroLink as well. So there's more than one sort of person at the trough for that. And that's not going to come until October. So right now we're in a bit of a cash flow crunch. So part of that, the agency's asked all the departments to examine their contracts, identify what's really essential for going forward. Obviously, we want to prioritize contracts and promises we've made to different vendors on ongoing work and different operational aspects that we provide services for. So those take a priority. Anything that we've got debt for, that we bonded for, we have a priority to pay that down. And then we start to look at some of our future contracts, either on the planning side or under construction. And again, even those, we have, I think, 4 tiers of buckets of projects that we think need to stay in construction, or otherwise, mothballing them would either jeopardize some of our grant monies, our loan monies, or the service promises that we'd made to the voters in Los Angeles County. So the most noteworthy is the Purple Line extension, right? So we're continuing our tunneling work on that, and that one, has kind of been helped on the construction schedule for this. We've had different agreements with municipalities, including the city of Beverly Hills, to allow us to continue construction during this shutdown during the pandemic. Which has really enabled us to accelerate how much work we're doing on that corridor. On the other hand, we do have different projects in the planning stage that we're not able to accelerate, and we've asked our vendors and our contractors to delay or defer those. Right now, we've asked for our fiscal year starts in July 1st, and so we're asking many of those contracts to delay or defer work through the first quarter, through September. And that's a challenge, because we're trying to keep things moving. We're trying to ensure that all the projects we have in our various voter approved measures are being delivered. But with our cash flow, we're just having a hard time to do it. The CEO, Phil Washington, has taken great strides to ensure that there's been no job reductions at Metro, and that's one of his critical mission statements that he'd like to ensure that we do. But part of that is we have to look to other areas that we can save money. So we've had to redo our budget several times in each of the departments, look at all of our costs, and try to minimize any expense that we don't need to maintain critical services. We have reduced in some degree or realigned, I think, our transit services on the bus and rail, but it's also important for many users. We still have several 100,000 daily trips being taken on our bus and rail fleet. So we're trying to keep those open as much as possible and maintain service. But it's a big challenge, both from an operator perspective and from a financial perspective, to keep everything moving.
Yeah, for all those viewers that are seeing this on the screen right now and what Mark's talking about, all this information is on Metro, and it's at Facts at a Glance. What you can see, that's the website, and really it provides some detailed information on here. Some things on the website that I found interesting as well was, it kind of goes into line of, how are you dealing or handling your internal operations? Kind of touched upon a little bit, but I want to kind of do a little bit more of a deep dive into, the working remotely or working at Metro or at the facility and COVID cases. So when I was looking at your website, one area of it was interesting to me because you have a kind of a metric or a tracking system of COVID-19 cases for your not only the county, but this is specifically for LA Metro. So if you could you kind of explain what the thought process behind providing these types of tracking or metrics, and what's going on in regards to this specific website?
Yeah, so as I mentioned earlier, we have over 10,000 direct employees that work at Metro. As this chart sort of illustrates, a number of contractors and consultants who are indirect employees for Metro. Within that, certainly as this was taking hold in the middle of March, there were a lot of questions coming at not only my department but the CEO's office, asking, are there any cases at Metro? Has anybody tested positive for COVID-19? Or at that time, I think we were still calling it a coronavirus. And so, there's just so much information out there, and we were trying to stay on top of it and get ahead of it, and doing weekly updates. But that proved to be challenging too, because you just get constant and consistent updates. And again, we're a 24-hour operation in a lot of ways, so we were getting cases that we were just trying to inform everybody, not only from a safety perspective, but also from a curiosity perspective about what it was. So we have had this tracking database. Just anecdotally, I'll share with you some of the pieces that I saw most closely firsthand. One of the things that I oversee is, as I mentioned, the express lane. So I have a service center down in Torrance, and we typically have about 100 people per day in that service center, employees and contractors. So March 19th is when the Los Angeles County Safer at Home order was in place. Metro immediately expanded their work from home policy to include any department that wanted to assign people to work from home were allowed to do that. So the CEO pushed it down to the departmental level and let the department heads make that decision. And so congestion reduction obviously moved into that realm, and we sent all of our employees home within the first day or two, or gave them the option. I think everybody in our department has chosen to work from home. We do have one person that goes in on a more regular basis, on a daily basis, but beyond that, all of our employees are working from home right now. But in our service center, in the first day or two or it seemed like the first day or two, might have been the first week, we did have somebody test positive in our Torrance service center, one of the contractors that is a customer service representative. And again, this is early time, so we didn't really know how to react. So we obviously, in an abundance of caution, immediately closed the service center. But at that point, I have 100 employees. I have to decide what we're going to do with,
Right.
And a service that we were providing there. Right. This is again what we would call an essential service. We tried to stay open to ensure that everybody that's using the express lanes has an outlet for that. We have hundreds, if not thousands, of inquiries every day on the express lane, so we have to address those. So we did have an emergency preparation plan in place, and we had what we thought was a good solution. We had 20 what we call thin clients, which was essentially a wireless modem along with a laptop that had direct access to our customer service portal. And so we sent 20 agents home with those thin clients. They were able to work from home, take calls from home. Importantly, I think keep their jobs during all of this and stay employed. We did have to furlough some of the workers because that's about half of our workforce, more than half of our workforce that weren't able to stay busy with the thin clients. But all of our other staff there, including our back office, accounting, finance, some of our technology folks that are down in that facility, continue to work remotely. Obviously, on the tech side of things, it's a lot easier for those folks to stay engaged. So we were successful in not only closing that facility, doing a deep cleaning of it. The minute that we heard that case was happening, and in hindsight, it looks like we acted appropriately by closing it because there's been a lot more cases. That employee thankfully tested negative more recently, about a couple weeks ago, and we were able to integrate them back into our workforce and I guess rehire them or continue employment for them. So that anecdote worked out pretty well in terms of not only how we reacted to the incidents, but how we were able to respond both on an emergency side and an operational side. And I guess the bottom line is that everybody stayed healthy and we haven't had any additional incidents at that facility. So it was closed for about 2 months. We just recently reopened it on, I think, June 8th, maybe, or June 1st.
Okay.
So we did another deep cleaning of the facility. I think, again, just out of caution, we did a deep cleaning originally and then closed it. Nobody was allowed into the building. But before reopening, we contracted with another environmental services firm to make sure that an additional deep cleaning was done before that. And have now, implemented, social distancing practices, every other workstation, and, nobody's sitting across from each other. Everybody's got appropriate spacing. Sort of have flexible work hours, flexible lunch breaks, flexible midday breaks, things like that. So it's been positive in that sense that we're able to reopen it. For us, we're an ISO 9001 facility down there. So even to take things like customer payment information or credit card information, we couldn't do that remotely. So we were basically left to having people fulfill things on the web if they wanted to make payments. But now we're back to being able to receive the revenue pieces of that operation. So again, from a service perspective, it's helpful, and from an agency finances perspective, it's helpful.
Yeah, and that's pretty informative because not a lot of people right out of the gate in around March timeframe, where majority of us started to work remotely, really had to handle situations in regards to someone testing positive in the workforce and things of that nature. Hopefully, not a lot of agencies had to deal with that from the very beginning. But it's good to hear that Metro did experience that and provide what at the time felt like the right thing to do. And I'm glad to hear that employee is doing well. So a lot of positives out of that. Yep. So certainly one of the things that Metro continues to do well. And but absolutely the other part is that not only does this tracking website is interesting was the other part is that you guys also have what you call the source. Yep. And that is basically the entire update of what Metro is doing in regards to COVID-19, about news and services. And this is updated pretty frequently, it looks like. So, Mark, what do you see the outlook of LA Metro to be? And in regards to the source, how's this information being relayed to the parties that would like to hear about it?
Yeah, so the source I think is a great piece of information. Obviously, we use it internally just to see what's happening in that big agency, right? It's hard to keep our finger on everything. Anna Chen does a great job on some of this. Steve Hyman, who we work with, does a great job updating this and providing these articles. It's used as sort of a blog service to blast out information. Like you said, sort of what's happening at Metro. But recently, what's happening at Metro is people's interest in COVID-19, and more recently on the Black Lives Matter and George Floyd incidents too. So we've had a lot of interest in the source, and it's to me been a great resource to actually see what's happening and see what steps Metro's taking, not only internally but on the customer facing side of the agency as well. So we try to do that on a regular basis. I know at times we do it on a daily basis if there's salient updates to it for sure. But it's been great, and internally we use it. We have newsletters that kind of update us on a daily basis in terms of one of the other facts at a glance that you pointed out. Looking at the number of cases, any new cases, any new orders from the federal government or the state and county on social distancing or reopening. One of the other things that we've done at Metro, and I should point out too that obviously it wasn't me acting responsibly when our employee got sick. I was following our well-established protocols. So we do have a lot of forms and a lot of administrative steps that we take for not only identifying when an employee is sick, but how to manage their time when they're off, how to record it for a timekeeping purpose, and what to do from a safety aspect to bring them back when they are on the healthy side of things. But the other thing that we do well, I think, is looking at how we will. It's hard to say. I was on a conference yesterday, and they talked about the changes from where we are now to normal. And I'm stumped as to what normal is, right? Like I know what it felt like 6 months ago or a year ago, but I don't know what normal's going to look like. Yeah. It felt. I mean, there's always something going on. That normal is a weird way to look at the world nowadays. But yeah, so I don't know what normal will bring for us in terms of people wanting to get close to one another on transit. Will that mean that more people want to drive to work in Los Angeles County? Will the flex time mean that not as many people will be driving during peak times? So there's a lot of changes that we're continuing to look at. We do think that, I think we certainly would indicate that, we follow the state protocols and the county protocols on safety and health measures, but also in terms of how we occupy our building. And that's kind of where we are now, is putting together a reentry plan. We have a reentry task force, and they've communicated pretty well, both at the board level and at the staff level, as to some of the ideas that we have. Again, we have a 25-story building that we populate every morning, or we try to populate every morning. And so how do we get people in and out of the elevators? How do we get them safely at their desks? Does that mean we'll have, even more flexible working hours? Will we have, alternate work days? Will we have, alternate staff days? Will work from home become more of a permanent measure, right? Prior to that, it did take special permission from both the department head, the head of human resources, and I think even at times the CEO to implement those work from home initiatives. But now it's been pretty successful by and large, at least on the express lanes and congestion reduction side of the house. We've had great success in people working from home. We've been able to advance projects through the environmental phases. our operations have remained in place, and for the most part, our relationships with private consultants, contractors, and vendors have been positive as a result of this. Longer term, it might be a challenge to keep that in place. So that's what our reentry task force is going to look at.
Yeah, so really, I think what you're doing at Metro and everyone that works for Metro, obviously, I would have to say, I speak for myself, those that are using these services and knowing that there is someone on the other side that is trying to get you to work, to and from work, or wherever you're going, utilizing your services in a safe manner and as clean as possible manner. That's great to hear. And that's why we're here today talking with Mark. That really is what this episode and series is about, to get some feedback from the agency and giving back to the community to inform folks. So I'd like to thank Mark for his time today with our COVID-19 series episode. And for all of you viewers that are watching this, thank you for supporting us at APWA Southern California chapter. We would like to let you know that we will have future programming, and it'll be all in our LinkedIn site as well as our YouTube site. We'll have that in the descriptions below. We'll link that for you. So if nothing else is there, I want to thank Mark for his time again. And until the next episode, this is Tran signing out. Thank you. Take care.
Thank you.